Hi, my name is Dr. Asare Christian. I'm a board-certified physical medicine and rehabilitation physician and the founder of Ethan Medicine, which is an integrative practice in Wayne, Pennsylvania that focuses on health as a way to solve pain, improve performance, as well as health spans, because when we're healthy, everything else works better. All right, so what are we going to be talking about today? This is our outline. First, we're going to define what neuropathic pain is, what are the symptoms of neuropathic pain, how to diagnose it from a conventional standpoint as well as a functional standpoint with specific labs that you can do to understand the root cause of the problem, how to identify the root cause of neuropathy, and look at treatment specifically from a conventional standpoint as well as integrative standpoint, talking about nutrition, diet, supplement, and of course, lifestyle modification. So what is neuropathic pain? This is the first thing we're going to try to define. So neuropathic pain is any disease state that affects the nervous system or the somatosensory system. What does that mean? So your nervous system consists of the brain, the spinal cord, and the peripheral nerves. So any type of lesion or disease that affects this system will lead to what we call neuropathic pain. So for example, in the brain, individuals who've had stroke or multiple sclerosis or Parkinson's can have specific neuropathic type pain because pain is also processed in the brain. In the spinal cord, when people have spinal cord injury, they can have specific pain complaints consistent with neuropathic pain. If people have also had in the periphery, diabetic neuropathy or carpal tunnel, all of those things can present as neuropathic pain. So if we're talking about neuropathic pain, we also need to understand the other type of pain that exists. So when it comes to understanding pain, there are three types of pain. Specifically, we have neuropathic pain, which is what we're going to be spending more time talking about. There is nociplastic pain and nociceptive pain. So what is nociplastic pain? Nociplastic pain is a pain that results from dysregulation of the nervous system. So it's a little bit similar to neuropathic pain, but we're not going to spend time on that today. And then the third type of pain, which most individuals are familiar with, is what we call nociceptive pain. This is pain that relates to inflammation of the tissue or the viscera. So that could be sickle cell disease, arthritis of the knee and joint. Those are all type of nociplastic pain, okay? And today, we're going to spend time specifically on neuropathic pain. So when it comes to neuropathic pain, this is not a clinical diagnosis. When we say neuropathic pain, it's just a description of a type of pain. The underlying cause of what is actually causing it varies in multiple individuals and how it presents itself. So now let's talk about the causes of neuropathic pain. So the main causes of neuropathic pain could be metabolic disorder, meaning disease such as diabetes, thyroid, and more importantly, nutritional deficiency. B1, B6, B12 tend to be implicated in all of these disease states. It could also result from injury or trauma, as we know, or entrapment. Entrapment could occur in the hands, so people can have carpal tunnel, people can have tarsal tunnel, people can have diabetic neuropathy, which relates to metabolic disorder. We can also have infections. So infections can actually also affect the body as well as the nerves. And as we define, when nerves are affected, you can develop neuropathic pain. And that's the case in HIV and even COVID-19, or people are familiar with shingles. It's a form of neuropathic pain. And then the last one is neurotoxin. So there's specific substances that are toxin or toxic to the nervous system. And that could be alcohol abuse, chemotherapy, mold exposure, mycotoxins, specific toxins in the environment, and even some of the medications that we use. So it is important always to understand the underlying cause of a disease when we're talking in medicine. So we talked about the etiology being either metabolic, injury, infection, or neurotoxin. And before you experience that pain yourself, it has to get manipulated through certain characteristics. That includes your genotype or your genes and the environment which you live in. So your experience with pain, and as we're going to talk about, pain is a complex phenomenon. So before you experience the pain itself of being neuropathic pain, your genetics and the environment you grew up in all influence that process. And that can lead to the syndromes that we call neuropathic syndrome. So now let's take a look at what happens when individuals have neuropathic pain. So from a pathophysiological standpoint, what is happening? We talked about neuropathic pain being an issue with their nervous system becoming affected by a disease or an injury. So when that happens, your cells mix all of this secretion of inflammatory cytokines and chemokines and proteases and growth factors. These are all the mechanisms that your body uses to heal itself. And what that does is it tells the nerves that there is an injury, there's something that you have to pay attention to. So from the periphery, when there's an injury, there is a signal, a cascade of inflammatory signals that lets your nervous system know that something is wrong and it's there to protect you, right? Because when something is hot, you want to move away from it, all right? So from these biological processes, an inflammatory cascade that's released that actually leads to modifications of how genes and certain proteins are expressed in the nervous system. And this can lead to more pain being perpetuated. And when we have elevated spontaneity activity in the primary nerves, that takes the information to the nervous system. This leads to what we call neuropathic pain. And this can lead to secretion of secondary mediators, notably something we call choline stimulating factor 1 and primary afferent terminals. Okay. We also know that within the nervous system itself, within the spinal cord, as well as in the brain, we have specific cells called microglia and astrocytes, which are also can become activated. So when the injury is healed, so for example, you crush your hand and the nerve injury is healed, you're still going to continue to have pain because the body has adapted and the nerves have adapted to keep the pain sustained in a way to protect you. But we know that that is pathologic. We don't want that to be the case. We want that to go away. So that's what happens when people have neuropathic pain. The great news is that this can be addressed from an integrative as well as conventional medicine standpoint. All right, so now let's talk about the classification of neuropathic pain. How do we classify neuropathic pain or nerve pain? So classically, we put them into two categories. We have mononeuropathy and polyneuropathy. So mononeuropathy, as the name implicates, suggests one side of the body, mono, that is affected. So it could be the right upper extremity, left lower extremity, one side of the body is affected. And that can result mostly from entrapment or trauma. It makes sense, right? So when you have neuropathy or carpal tunnel in your hands, it's an entrapment of the median nerve across the wrist, okay? So that's what we call mononeuropathy, one side of the body being due to an entrapment or trauma. When we talk about polyneuropathy, this is where you can have neuropathy in your hands, both hands, in the legs, or maybe two legs, one hand. All of that tends to be a function of more metabolic, toxic, systemic. Because when you have a metabolic disorder, it's not just happening in one side of your body, it's occurring in the whole part of your body. So when we classify neuropathic pain, it's mostly mononeuropathy and polyneuropathy. Hopefully this makes sense. All right. So now let's talk about what we call painful peripheral neuropathies. So this neuropathy seems to be very painful, and there's a list that I'm going to put out here for you. And it is not just coming from sciatica. I think most people, when think of neuropathic or nerve pain, they think of diabetes, but there's multiple things that can cause pain. So an example of those could be phantom pain, stamp pain, nerve transaction pain, neuroma, post-traumatic neuralgia, entrapment syndrome, mastectomy, post-thoracotomy. So when people have had surgery to fix their heart, that can actually lead to neuropathic pain, Morton neuralgia, painful scars, herpes zoster or shingles, as most people know it, diabetic mononeuropathy, diabetic amyotrophy, which actually tends to affect the muscles in the legs as well as causing pain, ischemic neuropathy, when blood is not getting to a certain part of the body, that can influence the nerves or cause the nerve to die, that can present that way. We also have radiation plexopathy, so people who have undergone radiation can have issues with their nerves, plexus neuritis, trigeminal or glossopharyngeal neuralgia, which is neuralgia that affect the cranial nerves, as we talked about earlier. Any disease that affects the central peripheral nervous system can also cause this type of pain. So let's talk briefly about generalized polyneuropathy. What are the main causes? So the first one, as we talked about, is metabolic or nutritional. So your cells, your nerves are cells, and they have specific function they have to do, and they have to use specific nutrient and energy to be able to take care of itself. So when we have a disease such as diabetes, people have disorder of the cells, of the nerves, that can lead to diabetic neuropathy. Alcoholism, people that drinks a lot of alcohol, and basically what is happening is with that process, there is depletion of your B vitamins. And as we're going to learn in this presentation, B vitamins are very, very important in helping with nerves and preventing pain. Hypothyroidism is one cause of mononeuropathy. We can also have drug-related issues that can lead to generalized polyneuropathy. So antivirals, which are medications that we use to treat viral infections, HIV, cisplatin, which is a medication used to treat cancer. We have specific antibiotics, including nitrofurantoin, metronidazole, medications such as amiodarone and dapsone can all cause neuropathy as a result of the drug. And then we also have specific toxins that are actually present in our environment. So we have acrylamide. This is something that happens when we use oil and fry food. That could be something that we see. Arsenic can affect the nerves. ethylene oxide can also affect the nerves. So these are the generalized polyneuropathies and the underlying causes of those. More, we can also have it as a result of hereditary function. So you can inherit specific genes that can predispose you to develop a neuropathy. And one of those is what we call amyloid neuropathy, Charcot-Marie-Tooth disease type 5 and type 2B. This is too much for you to think about if you're not in this area of study. And then also malignancy. We know that carcinoma that are associated with something we call paraneoplastic peripheral neuropathy and myeloma can also cause generalized neuropathy. We also have infective or post-infective immune courses of neuropathy. As we talked about, immune cells, infections can also affect the nerves. And that's the case in what we call acute or inflammatory polyradiculopathy, neuropathy, or Guillain-Barré syndrome. Maybe people have heard of that. People are going to have HIV. And in fact, people that have COVID, majority of individuals with COVID would develop neuropathy. And it tends to be even more significant when people have post-COVID issues or what we call long COVID. Other neuropathies can also exist, including something we call idiopathic small fiber neuropathy. There is other things that we call central pain syndrome. This tends to be any disease that affects the nervous system, specifically the central nervous system, the brain. So post-stroke or what we call thalamic pain syndrome can present with neuropathic pain, multiple sclerosis, spinal cord injury, traumatic brain injury, Sering or syringomyelia, complex regional pain syndrome are also a form of neuropathic central pain. Tumors, chronic low back pain with radiculopathy, Parkinson's, syphilis can all present as central pain conditions that manifest as neuropathic pain. So now let's talk about the symptoms of neuropathic pain. And when it comes to talking about neuropathic pain, it's not just the numbness, the pain that people are familiar with. There is actually what we classify as positive signs and negative signs. And then there is also specific description that goes based on the type of nerves that become affected. So most people know that neuropathic pain, or how patients would describe it in a positive sense, includes burning, pain, feels like walking on cotton wool, and like sensation on the feet and trunk. Pins and needles is the classic description that individuals will give. The negative symptoms include numbness, loss of sensation of the hands, and even weakness. So neuropathy is not just a sensory complaint. Sometimes motor involvement or there's weakness associated with it. Sometimes there is proprioceptive loss, meaning individuals cannot tell where they are in space. So all of that is something that we have to think about when we're talking about neuropathic pain, not just focusing on the pain, but the other underlying conditions that need to be addressed to help people heal. And then we also know that when people have large fiber neuropathy, when the neuropathy affects the nerves, you have large fibers and small fibers. We didn't get into all of this as much, but there's two fibers that takes information to the brain, the nerves specifically. So large fibers tend to manifest with loss of joint position, as I was talking about, with proprioception. And then small fibers tend to manifest with impairments in pain, temperature, as well as autonomic function. So it's not just pain. There is also autonomic involvement, which can implicate how people experience neuropathic pain. So those are the symptoms of neuropathic pain. So now let's talk about diagnosis. How do we diagnose neuropathic pain? When you have pain and you go to your doctor, if you're a clinician and you're trying to understand how you diagnose it, we're going to look at classically the conventional approach, looking at how neurologists or physiatrists, physical medicine clinicians do specific testing, and then going beyond that and also talking about some of the root cause functional tests that actually also makes a huge difference in understanding how we can help individuals with neuropathic pain. Because as it turns out, the conventional approach that we have works really well, but there's limitation to some of those tests. And this is why we have to look at other lenses to really get us to understand how we can help individuals with neuropathic pain. Diagnosing neuropathic pain. First, we have to do a good history and a physical examination. So we have to understand all of your history, your type of medicines that you're taking, type of occupation. If individuals are typing all the time, they're more likely to develop carpal tunnel. If individuals have alcoholism, if individuals have exposure to specific medications and toxins, all of that helps us to get to a place of understanding what may be causing your neuropathic pain. Because as we talked about, neuropathic pain is a clinical description. It's not a diagnosis. There could be multiple things that could cause that. So it's important for us to understand who you are as a person, what type of occupation, what type of surgeries. Because in fact, when individuals have had gastrectomies or bariatric surgery, where part of their stomach has been taken out, that limits the body's ability to absorb B vitamins. As we're going to find out, B vitamins are very, very important, and specific nutrients are important in preventing neuropathy. So we need to understand all of that. Then there is specific neurological exam to understand strength, sensation, reflexes. That all helps us to get a better sense of what's causing it. And then we can also do what we call EMG nerve conduction studies. We can also do specific labs looking at biochemical, immunological, genetics, and in some cases, imaging, including MRI, ultrasound, can be helpful with a diagnosis. So let's talk a little bit about EMG. This is the main tools that we use as clinicians to get a better sense of what is going on with your neuropathic pain. Because again, neuropathic pain is just a description. What is the underlying cause? And understanding the underlying cause gives us a place of how we can treat. So a nerve conduction study, EMG, is a primary diagnostic tool in the evaluation of patients with large fiber neuropathy. So as we talked about, this only looks at the large fiber. It's not looking at small fiber. If we want to look at small fiber, we have to use a different approach, and that includes testing, specifically doing a biopsy, and a lot of times doing a functional medicine dive and looking at the nutritional status, which can influence how individuals will develop neuropathic pain. So again, people can have neuropathy or neuropathic pain. They can do an EMG nerve conduction study, everything comes back normal, and they're still having symptoms. So there is limitation to that testing as well, okay? And then we also know in recent years, MRI and ultrasound has been used to kind of look at the integrity of the nerve to get us a better understanding of what's going on within the nerve and its health. So in terms of labs, from a conventional standpoint, we will check A1C, thiamine, folic acid, B12, TSH, ESR, checking for heavy metals in the urine, serum protein electrophoresis or immunofixation to rule out other type of cancers, looking at the liver function, checking for signs of alcohol, checking CMP, GGT, AST, and AA. These are all tests that we use to understand individual status in terms of alcohol intake, checking for hepatitis profile, serum lactate, pyruvate, and ammonia are all things that we need to understand because all of those can influence neuropathic issues. And I talked about potential skin biopsy if we're looking for small fiber neuropathy. Things that we talked about is the conventional way of diagnosing and making sense of neuropathy. Now let's look at the functional medicine approach. Because when it comes to the conventional approach, EMG has limitation, imaging has limitation, and now we have to look at what's actually going on at the cellular level. That gives us a root cause. We need to be able to identify the root cause because sometimes the EMG is normal and people are still having issues, right? So a better way to understand all of that is going a little bit deeper. So this is why we can use specific functional medicine testing, looking at micronutrient testing that looks at minerals and vitamins, as B vitamins specifically. And we're going to talk about the role of all of these specific deficiencies and how we can actually use that to heal individuals suffering from neuropathic pain. You can use something called GI 360 on Rupa Health as a functional medicine clinician, or as a patient, you can ask your doctors to do that for you. And that gives you a better sense of what's going on in the gut. Because as it turns out, the minerals and the B vitamins that are involved in disease relating to the nervous system, all of that get processed in the abdomen. So when people have dysbiosis or a problem with their gut, that can predispose them to neuropathy. So getting a better sense of the state of health of the gut is very, very important. And we also know, we have tons of literature that shows that individuals that have gut dysbiosis tend to have more pain or tend to have inflammatory cascade that can also predispose individuals to neuropathic pain. We can also do specific testing called CytoDX from a functional standpoint that look at the inflammatory markers. These are things that we didn't go through as much, but the idea is that when you have this injury in the periphery, there's inflammatory cascade that takes place, and that inflammatory cascade is what is keeping the pain state where it is. So it's important for us to understand the status of your inflammation. We also know that hormones plays a huge part in your pain as well. So from a functional standpoint, you can check hormone levels. You can use HUMAP, which check the sex hormones, HPA system. All of these are involved in pain processing and perpetuation. So a summary of the tests that you can do that will give you more information from a functional standpoint include micronutrient testing, checking for vitamins and minerals. Also GI 360, looking at the gut health. We can also use CytoDX, look at the inflammatory state of the body, and then also looking at hormones with HUMAP, which give us a sense of the hormonal levels. Thyroid, we talked about thyroid playing a part in this. Thyroid, sex hormones, cortisol, estrogen, progesterone, all of that influence me. So getting a better picture, a comprehensive picture, helps us to better figure out how do we help people to get away from neuropathic pain. So now let's talk about treatment of neuropathic pain. So we have two approaches. The conventional approach we will talk about. Basically what that does is focus on symptom. So we're using medications that are blocking just the propagation of the pain signal to the brain. Okay? And that is one way to solve symptom, but it's not really solving the problem itself. And I'm sure you're all interested in the root cause, as well as finding root cause solutions to the problem that individuals deal with. So let's talk about first the conventional approach, which is pharmacological treatment. So this is where your doctors can prescribe medications, and specific medications that we have a lot of evidence for to help with pain include tricyclic antidepressants. This include things as amitriptyline, nortriptyline, imipramine. All of these medicines also have significant side effects that we have to be aware of. We can also use SSNRIs. So this is the medicines that we use to treat this depression, such as duloxetine or venlafaxine, all things that can help with neuropathic pain. And this is something that's approved by the American Academy of Neurology and other organizations that study neuropathic pain. We can also use anticonvulsants. And again, all of these medicines are not specific. These are medicines we use for other disease states and trying to use them to address neuropathic pain. So within that, we have sodium channel blockade. So the reason why we use these medicines is that for the nerve to take that information to the brain, there is something we call action potential. And sodium channels opens and close to allow the electricity to propagate to the brain. So what we can do with these medicines is that we can actually block those signals, and that's kind of how it helps with pain. But we know that by blocking that signal, we can also affect other systems within the nervous system. And again, that leads to side effect. So some of the medicines that we use are carbamazepine, lamotrigine, topiramate, valproate, as well as oxcarbazepine. We can also use other type of anticonvulsants, which are a little different, using something we call calcium channels, and these are gabapentin or pregabalin, which is Lyrica that individuals or most people are familiar with in terms of nerve pain. We can also use topical anesthetics to help with that. Sometimes we can use opioids, tramadol, if the other systems are not working well, but this again is not something that we recommend. We can also explore cannabinoids, so THC, CBD can also help with neuropathic pain. And then there is specific interventional therapies that we can do to also help with neuropathic pain. So this includes spinal cord stimulators, nerve blocks, as well as neuromodulators. So these are all options that we can help to address neuropathic pain. But again, all of this is solving that pain signal. It's not solving the underlying problems. All right. So now let's talk about integrative treatment for neuropathic pain. How do we get to the root cause? Because we recognize that, yes, there's a place for the pharmacotherapy. Those medicines can help us, but sometimes they tend to cause more side effects. So what are the ways that we have science to support that can help with neuropathic pain? So one, I like this diagram here, which talks about dietary nutrients. So we can look at dietary nutrients. This falls in a regimen of dietary regimen, and we can talk about ketogenic diet briefly, caloric restriction, protein deprivation, and high fiber diet. We can also talk about macronutrients. These are your omega-3s, omega-6, omega-9. This can all help with neuropathic pain, and we have a lot of science to support that. We can also look at micronutrients. These are your minerals, including manganese, selenium, zinc, calcium, iron. And then we also have vitamins, which plays a huge part in how the nerves heal and how nerves take care of itself. So this includes the fat-soluble, which we have A, D, E, and K vitamins. And then we also have the water-soluble, which includes vitamins B and C. And the big point is vitamin B is very, very much involved in helping with nerve issues. And we're going to find that out. All right. So in terms of dietary regimen, things that people can eat differently to help, we've studied all of this in humans as well as animals. When it comes to ketogenic diet, we don't have conclusive study that this really helps in terms of neuropathic pain. Caloric restriction, the evidence is maybe, and the point is when we do those type of dietary programs, there's other benefit beyond just solving nerve issues. So there may be some benefit there, but obviously making sure you have guidance with that process. Protein restriction has not been shown to help with neuropathic pain. If anything, it seems to increase it. And then we also have literature that suggests that high-fat diet actually causes more pain for individuals with neuropathic pain because of inflammation. Fat tend to be more inflammatory in nature. All right, so now let's look at macronutrients. These are your omega-3s, omega-9, DHEA, EPA, which are forms of omega-3, as well as alpha-lipoic acid. So when it comes to omega-3, this is something that is very important in nerves healing because this forms the membrane of the nerves. The nerves are fatty tissues. So to be able to make those membrane and to work and to conduct electricity, which is what the nerves do, or send signal, it needs omega-3 fatty acids. So we know that omega-3 fatty acids support visual and neural development, and defend against oxidative stress as well as neuroinflammation. These are all processes that are involved in neuropathic pain development. ALA and omega-3s has been held and noted to help with neuropathic pain relief, nerve regeneration, and improve carpal tunnel outcomes in specific studies. Deficiencies in specific omega-3s, DHA specifically, has been linked to neurodegenerative disease. And we also know that DHA promote axonal growth, which alleviate oxidative stress and reduce systemic inflammation. Now let's talk about omega-6 and omega-9. Studies have shown that omega-6 can support neurodevelopmental and vital for nerve regeneration. Oleic acid in omega-9 counteract nerve demyelination in diabetic rat models. So we have some studies from animals that shows that this could be helpful in managing neuropathic pain. The good thing about this polyunsaturated fatty acid is that we have tons of studies that also show its benefit in cardiovascular health and other disease states. So even though we don't have strong evidence for some in the case of neuropathic pain, exploring those things may not harm you, provided you're talking to the right clinician and making sure you're having guidance. One of the things I want to say, even before we move forward, is that these are things that we consider natural and safe. But the big point you want to take away from any of these things is that natural does not always equal safe. Because in fact, a lot of the drugs and pharmaceutical agents that we have are actually from plant derivatives or from plants, natural sources. So natural should not be equal safe, and safe, or what is safe for you, may not be safe for me. So you always want to talk to your clinicians and your healthcare providers to get guidance with any of these discussions that we are having. All right, now let's talk about alpha-lipoic acid. This is something that maybe most of you have heard of. It's an antioxidant, and in clinical trials, it has been shown to improve symptoms in carpal tunnel before and after surgery, as well as diabetic neuropathy. Alpha-lipoic acid also have anti-inflammatory and anti-apoptotic effects, meaning it can work on downregulating specific chemokines and cytokines, including IL-1 and IL-beta. These are all inflammatory cytokines. So we know that ALA can downregulate those things, which can help with overall health of the cell, including the nerves. All right, now let's shift our attention to micronutrients, micro. So here we're talking about minerals, specifically zinc, selenium, manganese, iron, and calcium. We're going to talk about a few of those. And then we're going to be talking about the vitamins, the water-soluble, and the fat-soluble vitamins. So thiamine, let's talk about vitamin 1, B1. Thiamine is a very important vitamin because it is vital for carbohydrates and amino acid metabolism, which is influencing all the major energy pathways in our body, including glycolysis, as well as the Krebs cycle. So basically, for your body to make any energy based on the food that we put in our body, you need B vitamin in the mitochondria to allow that to work. So we know that when people are deficient and the cells don't have the energy to power to heal itself, this is where things can go wrong. Okay. And by supporting the production of energy, molecules like ATP and NADPH, thiamine or B vitamin facilitate numerous cellular processes and reactions, benefiting both the neurons and the glia cells. We also know that thiamine deficiency in beriberi disease, a sensorimotor axonal neuropathy with symptoms like weakness, limb numbness, administering thiamine either orally or injection has been proven to alleviate symptoms of beriberi. So let's look at how B vitamins are so vital in the regeneration of nerves as well as preventing neuropathic pain state. So we know that the vitamins that are really involved in nerve healing and nerve pain are B12, B1, and B6. And when it comes to B vitamin, except for B3, which we can make from tryptophan, the human body cannot synthesize B vitamin. We have to obtain them through our diet. The good thing is that we have multiple sources to get B vitamins into our body through plants like rice, wheat, but also from animal products such as meat, dairy, as well as eggs. B12 vitamin is unique because it's only found in animal tissues and products such as fish, egg, and dairy, and this is where supplementation may be needed for individuals. B vitamins, also especially B1, B6, and B12, play a crucial role in physiological processes and support the peripheral nerve regeneration. One of the things I want to talk about briefly to kind of get you to understand the importance of these B vitamins is looking at this particular diagram here. It talks about how do the nerves become dysregulated. So we have here, when there's an injury to the nerves, we need B vitamins to help the nerve to heal. So when those things are not available, this is when we can develop disease and complications. So B vitamins are essential, not just for the nerves, but overall energy production within the cell. All right, now let's talk about vitamin D. I think everybody has heard of vitamin D. So vitamin D is this mainly in the form of D2 or D3, which we can get from making through the sun. So humans, we get most of our vitamin D through the skin, through a synthesis process using the sun. And vitamin D has been proven more effective than vitamin D2. So D3 has been proven to be more effective than D2 when it comes to nerve regeneration. And treatment with vitamin D3 improve axonal growth, myelination, and also boost expression of myelin chains. Vitamin E, briefly, this consists of 8 isoforms. They are primarily found in plant sources, with key dietary contribution being vegetable oils and nuts. All members of the vitamin E family act as strong antioxidants, shielding the cell membranes from damage and playing a pivotal role in guarding against aging and various disease. So this is something we can use for nerves and also to improve overall health. Vitamin C, crucial for growth, repair, and maintenance of body tissues, including collagen formation, iron absorption, as well as immune function. So vitamin D studies have indicated that ascorbic acid enhances nerve recovery after injury, improving motor and sensory performance, and promoting axonal and myelin regeneration, which is what we want when we have damage to the somatosensory system or the nervous system. Now let's talk about minerals. Briefly, manganese, zinc, these are all things that are needed for the body to be able to provide energy to the cell and also reduce oxidative stress or provide antioxidant benefit to help the body to heal. So minerals are important. Calcium, selenium, all act as antioxidants, and there's studies in animals that shows that this can actually improve nerve injury. So now let's talk about how we put all of this together. So we've talked about neuropathic pain. What is it? What causes it? How we diagnose it? And how we treat it from conventional standpoint, including medications, and looking at the functional causes, get into the root cause, understanding specific labs that will give us a better information, including macronutrient testing and vitamins and minerals, getting GI 360 to get a sense of the microbiome and what goes on that can perpetuate the pain cycle. We also talked about QMAP, which has the capacity as a functional test to give us all the hormones involved in sex and thyroid and all of that influence the body and pain. And now we have to put all of that together. By understanding all of those things, we have to figure out what do we do for the patient in front of us so we can explore pharmacotherapy agent, but we have to understand the risks and the benefit for that. And then we also can focus on non-pharmacological approach. And in fact, when it comes to neuropathic pain, pharmacological agent should complement, not replace non-pharmacological agents. Okay, so we want to use the medicines only to complement and fundamentally getting back to repleting the vitamins, getting people to change their habits if they're drinking, to kind of back away from that, working on the thyroid, working on the sex hormones, all of those things, when those are worked out from a systemic standpoint, specific neuropathies that are stemming from metabolic standpoint, which seems to be most of individuals' cases, get better. We also want to include some mind-body approaches, which helps with pain and understanding the perpetuating factor of the neuropathic pain: sleep, exercise, proper nutrition, stress management. You understand all of those things are helpful in helping with managing neuropathic pain. And more importantly, again, we want to make sure that we get the right diagnosis so then we can get the right treatment for the patient. Thank you for your time and attention. Take care.